Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use personal protective equipment, such as gloves. The following information represents American Heart Association guidelines and best practices for measuring and improving the basic life support skills of the teams you work with. The guidelines recommend that healthcare providers tailor the sequence of rescue actions based upon the presumed etiology of the arrest. ACLS providers functioning within a high-performance team can choose the optimal approach for minimizing interruptions in chest compressions. There are different protocols to maximize chest compression fraction and high-quality CPR. High-performance teams are essential to successful resuscitation attempts and can translate to improved survival for patients in cardiac arrest. High-performance teams effectively incorporate timing, quality, coordination, and administration of the appropriate procedures during a cardiac arrest. In addition, these teams clearly identify their overall purpose and goals. They are aware of the skills each member possesses and not only understand each team member's motivation, they know their strengths and weaknesses. High-performance teams also incorporate effective conflict resolution and communication skills. And last but not least, high-performance teams continually measure their performance, evaluate the data, look for ways to improve performance, and then implement those learnings. One of the measures of a high-performance team is the ability to achieve specific performance metrics and a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest event. You can only achieve a high CCF by eliminating pauses during high-quality CPR. The Resuscitation Outcomes Consortium, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You can't improve what you don't measure. Whenever compressions are paused, compressors should hover over the chest and be prepared to resume compressions. 15 seconds before pausing compressions at the end of each 2-minute cycle, high-performance teams should check for a pulse as a placeholder, pre-charge the defibrillator, and be prepared to deliver a shock in 10 seconds or less.
Minute 45.
Okay, let's go ahead and charge up.
Go ahead and get ready to rotate.
Do we have good pulses with CPR?
We have good femoral pulses with CPR. Okay, we're at 2 minutes. Stop CPR.
That's a shockable rhythm. Shock.
Clear the patient. Shocking. Start CPR.
Switch compressors. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible.
3, 2, 1, switch.
Clear the patient. Shocking. Start CPR.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course. Successful high-performance teams also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly. Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired during these compressions. I'm gonna need some help after this.
Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake. The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members. Finally, how to communicate. Closed-loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed. In addition to using closed-loop communication, teams should use clear messaging. Concise, clear language helps prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members. Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful, and emotions can run high. Understand that this is the nature of CPR, and remember the life you're trying to save. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and deficiencies to light. Implementation of debriefing programs may even improve patient survival after cardiac arrest. It's not enough to know what to do, or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Remember, you cannot improve what you do not measure. For more information on how your team can implement this type of program, please ask your instructor for more information.